Yes.
Okay. Good afternoon, and thank you, scientists, and thank you, Dr. Quresh, for having me. And I'll be speaking on your investigation in dry eye for next few minutes, as explained by Dr. Hijab about the tear film oriented dry eye diagnosis. The core mechanism of dry eye, according to the recent consensus in Asia, in Asian Dry Eye Society, is tear film instability. And when we are trying to find a cause in between these layers to say what is deficit, and it is known as tear film oriented diagnosis or TFOD. And if we classify these investigations, what we are going to perform for dry eye, we broadly have classified into tear film volume assessment, tear film stability, ocular surface status, or the measurement of the visual disturbance. And we will take it one by one. This is a newer way to test measurement of tear volume at the tear meniscus, and it is done by anterior segment OCT, and the cutoff value for this is 0.3 mm. This test is highly reproducible, non-invasive, and it has a significant correlation with the Sharma 1 as proved in literature, and it has a sensitivity of 67% and the specificity of 81%. And another thing to study this volume, there is a strip meniscometry, and it measures the amount of tears, and cutoff is 4 mm. It also has a good sensitivity and specificity. Basically, it has a polyurethane backing, and it has a tear absorber non-woven fabric, and it doesn't really touch the conjunctiva and test the uh, tear volume. And if you have some more money to spend, you can have this expensive instruments like Oculus keratograph, which will give you a lot of information. It can measure up to hundredth of millimeter along the meniscus about the tear film volume, and it has also a program into which the questionnaire, OSDI questionnaire, tear osmolarity, blink rate, or all these things can be incorporated in a report, and a customized report about the dry eye can be made and discussed with the patient. And the on the follow up, the what how the treatment has helped him can be discussed with the patient. And this was discussed by Dr. Hijab. This is a new concept being promoted by a Japanese group, which tells us that the area break, the spot break, line break, or the dimple break tells us that there is a deficit in the aqueous. And if it is a random break, it tells that it is a evaporative dry eye. If we are studying this on a routine slit lamp, this can be done on that. And if we but these cartographs have a software to capture this, to observe, document, and grade staining pattern, and also further how the treatment, how the drops are helping can be studied and discussed with the patient. But if we don't want to use any fluorescein, now there are this tear film stability analysis system, TSAS. And here we don't have to use fluorescein and screen a dry eye. And this is what will happen over a period of time. Very quickly, the irregular astigmatism will increase in such patients, the surface irregularity index will change, and the surface asymmetry index will change. These are some of the parameters which are studied in this tear film stability analysis system. And not only this, newer gadgets, the keratograph can also give us precise breakup mapping and time measurement without the use of fluorescein, which has certain drawbacks. And if we are now aiming to test the tear film stability, LipiView is a good diagnostic tool. It will tell us the health of the lipid film, and if we are and also can give information on how much meibomian glands are working, how much is the dropout, and this can be very nicely discussed with the patient and further managed. Now, a concept, a word about tear film osmolarity. As we all know, that tear film osmolarity basically tells us the uh, 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 balance between the production, the evaporation, and drainage, the absorption of the tear film. So it's a very important tool. It's a very important information which can tell about the status of the dry eye, and the various ways to study this are device using electrical impedance to measure tear film osmolarity, vapor pressure concept, and freezing pressure osmometer. We will not be going into the detail, but the most commonly what is used are the devices using electrical impedance, and the devices are the tear lab or the eye pen, which are being used. And this is how this tear osmolarity is tested, and a value of 308 osmol per liter is the cutoff, and if we have a value more than this, then there is definitely the tear film is unstable and patient has a dry eye. Before we kind of complete, I think biomarkers should be discussed. The high patient with early dry eye characteristically have lower protein content compared with patient who do not have dry eye, and high levels of inflammatory biomarkers like matrix metalloprotein 9 may lead to early diagnosis of dry eye. And there are various ways of doing it, like this instrument, and the ways to do it are tear scan, micro assay system, iPrim, and SJO. And to study the cell, now the impression cytology, we have a replacement, the newer technique of confocal microscopy, which can give us the uh, what's quality of the cell, the phenotypic alteration in the in Jogren patients or any other patients, what where we want to study. It can also even give us there is a research going on which will tell us the condition of the lacrimal gland even. And this new concept of functional visual acuity, basically what they are trying to tell is visual acuity by forced eye opening was measured under topical anesthesia, and it was named as functional visual acuity, whereas the conventional visual acuity represents the highest vision at a given examination time. And and what are the advantages? The advantages are diagnosis and screening of the dry eye, judging the treatment effect. How this is done? This is the instrument by which it is done. Landolt ring type prototype is optotype is shown to the patient. If the response is correct, then there is no problem. If it is incorrect, the size is increased, and this is and with time, what happens is there are bigger changes noted in patients of dry eye over a short span of 60 seconds. So this is what I had to tell you about the newer investigation in dry eye. Thank you.